everyone, my name is Dini. In this video, I will explain about anemia. Starting from the understanding anemia, causes of anemia, types of anemia, and how to handle anemia. Okay, now, what is meant by anemia? Literally, anemia comes from the Greek anemia, which means from the word a, which means no, and haima, which means blood. So, our people often call it the term lack of blood. However, in the medical world, the more precise definition we use is anemia, which is a decrease in the oxygen carrying capacity of the blood. Where in our blood there is one component in the form of red blood cells or erythrocytes whose function is to deliver oxygen throughout the body. So that if red blood cells are lacking, the oxygen delivered to our body will not be optimal. So that symptoms of anemia appear such as weakness, fatigue, lethargic, sluggish, and negligent. However, the term lack of blood is not appropriate because the decrease in oxygen carrying capacity doesn't have to be due to a small number of red blood cells. There is also anemia with normal red blood cells but low carrying capacity. For example, because of an abnormal structure or because of a shorter lifespan. In diagnosing anemia doesn't see based on the number of red blood cells or the number of erythrocytes, but looking at the level of hemoglobin, which is part of red blood cells, whose function is to bind oxygen. It better describes the oxygen carrying capacity of red blood cells, not the amount.
Then, I will explain about the symptoms of anemia. Symptoms of anemia vary widely. Depending on the cause, people with anemia may experience symptoms such as: first, weak and tired quickly. Second, headaches and dizziness. Third, often sleepy. For example, sleepy after eating. Fourth, skin looks pale or yellowish. 5. Irregular heartbeat. 6. Short breath. 7. Chest pain. And 8. Cold in hands and feet. These symptoms are often not recognized by the patients at first, but will be more pronounced as the anemia condition gets worse.
So, what are the types of anemia? In general, anemia is divided into three types. The first, anemia that occurs due to ineffective red blood cell production, can be caused by a lack of nutrients that we consume or abnormalities into the bone marrow is a factory of blood. For example, iron deficiency anemia, which is the most common anemia in society. The cause is a lack of iron that we eat. Then megaloblastic anemia due to lack of folic acid and vitamin B12. Then anemia due to chronic disease and aplastic anemia due to abnormalities in the bone marrow, which is the factory of blood. The second is anemia that occurs because the destruction of red blood cells increases. Also known as hemolytic anemia, in this type of anemia, the lifespan of red blood cells, which should be 120 days, is shorter because they are destroyed early. The symptoms are usually that patient does not look pale but looks yellow because of the red blood cells. The red blood cells are broken down to produce bilirubin. In these patients, they must be routinely transfused from donors to treat anemia. The third is anemia caused by blood loss or bleeding. In this type of anemia, a lot of red blood cells are lost due to tearing of blood vessels so that a lot of blood falls out. For this type of anemia, the treatment is that the source of the bleeding must be stopped.
Then, prevention of anemia. The most important prevention of anemia can be done by eating foods that contain iron, vitamin B12, and folic acid. Some other ways of prevention are: first, ensuring sufficient vitamin C in the body through food, drinks, or supplements. This is so the body can absorb iron. How to do a balanced diet? Second, take calcium supplements because they can affect the way your body absorbs iron. Third, avoid consuming caffeine drinks and take vitamin C so the body can absorb more iron from food.
Anemia cannot be taken lightly because very severe anemia can cause death. Now that we know what anemia is, what are the symptoms, types, and how to handle each type of anemia, hopefully we will always be healthy. Thanks for watching.